Hello, guys. Good evening, everyone. Good evening, YouTube family. Here we are again and again, guys. Welcome to my YouTube. If today is your first time watching this channel, please don't fail to like, share, comment, and subscribe. It is your lovely girl again, Jovita, on this video. So guys, stay tuned. Remember, we're dealing on skill stuff, guys, and today I will be taking us through second year first semester courses on nursing program. Guys, the first course you will encounter in your first year, in your second year first semester, is medical nursing. Guys, there are a lot of topics. When I say topics, there are a lot of topics on this medical um, nursing. So one of the topic you will not like to miss among all the topic is nursing responsibility. Wow, guys, if you've gone through your first year first semester, I mean, you talk about you know you talk about history of nursing, and you probably refer back to fundamental of nursing. You equally discover some of the roles, duties of a nurse as a whole. So if we're able to know who you are in this particular profession and what your responsibilities are, I think that first topic you'll be able to handle it properly and you'll be able to do well on it. So one of the basic in nursing responsibility, we have a lot of responsibility and the roles we normally play in nursing. Probably our major responsibility in nursing is um you know is mainly focused on respiratory uh system disorder. That is where nurses base most of their responsibility, but other areas anywhere there are other roles as well which they play. Now guys, nursing role, nursing performs so many roles in this profession. Nurses are caregiver, which we all know, and nurses are known as an educator. They are instructor. They are an advocate. They can stand in for you. So there are a lot of responsibilities. I mean, when you encounter a nurse, you know that yes, you have gotten someone. So they have a lot of, you know, uh, roles they play in a healthcare setting. Now, in this nursing role and responsibility, in terms of particularly a patient with a chronic diseases, so as a nurse, you know what to do if you really understand the role of nurses and their responsibility in your first year, and probably some part of it in fundamental. You'll be able to deal with this first topic known as whichever, whether it's acute disease, whether it's chronic disease, you'll be able to handle it very, very good. Okay, now guys, second topic you will also see is nursing care with patient nursing care with patient with cardiovascular disorder or rheumatic diseases. They are just the same thing. In cardiovascular, remember, they are all these things, they has to do with respiratory system disorders. So in this area, if you looked back in cardiovascular, in your anatomy anywhere, you will really see that the heart, we have four really chambers of the heart: the right atrium, the left atrium. And if you really go back to your anatomy, you'll be able to understand how the blood flows and how it pumps blood into the arteries and into the veins and the bodies. Then that will really help you a lot in understanding this particular topic very, very good. And how and in our beta block as well, it also help you to, in terms of this respiratory system, because it deals with mainly the lungs and the heart. And in beta block channel, we normally have two two things we need to look into there, which is the lungs and probably the heart. So in this area, if you understand it very well, you'll be able to handle this particular cardiovascular disorder problem. And as a nurse, you will know the kind of care and assistance in which you will be able to administer to such patients. Now, the next topic you will not like to miss is what the care, nursing care over patient with respiratory system, which I have previously said. When depending the kind of respiratory disorder the person is having, whether they are acute, whether they are chronic. In respiratory disorder, there are, the acute one could be in, flu, influenza, the all the stuff. So they are not really, they just need some little antibiotics and all the rest of it to handle. But the chronic part of it, when you talk about tuberculosis and asthmatic and all those arithmetics, when you talk about the chronic part of it, the ones that are very chronic, that takes longer time to take, to 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 care for. So these are what you need to put into consideration. So respiratory, and you able to make use of your spirometer very well, and your inhalers and nebulizers, depending the kind of disorder the patient is really going through. So this topic will enable you to understand what to do as a nurse. Then the next topic again, guys, you're going to look into is electrolyte. Electrolyte, we all know about electrolytes. They are just electrolyte and fluid imbalance. We talk about water, and here now you also talk the acidic bases and imbalance. You talk about acidosis and alkalosis. I think this is where you probably come across such a topic. Then the next one, the next topic you look into is nursing approach to elderly. In elderly, we normally, I talked about the elderly, maybe I think I really refer it in social responsibility. They really need our help at that age. They really need support. We need to play a role as a nurse in helping them, taking care of them, meeting up their needs and some of the things they cannot do for themselves. So that is your role as a nurse, to help them, to even in their psychological imbalances and all the rest of it. You are there to assist and give help. Now the next topic again, guys, you will not like to miss is a nursing care over patient with hematological and lymphatic disorders. Now in this you can call it hematoma or something like that. It's just a blockage, a fluid that has to do with right insides, either within the a kind of a blockage. Is just like a blockage. It's just like a blockage that that stops the proper inflow of blood through the vein, the artery, through the body system. So we regard it as hematoma, or you can call it hematological lymphatic disorder, because it deals with it is connected with the bone, especially the joints, some of them, anything that had, and that any patient going through such kind of disorder goes through a lot of pains, and sometimes one of the symptoms, they can develop some edema, swellings, and so many of them. So this course will go a long way to teach you a lot, guys. Then the next one you will not the next one is a patient with cancer. As a nurse, you really need to administer a proper care for a patient with cancer and cancer pain. You have to be be empathetic and all the rest of it. Then the next topic again, guys, is a patient with gastrointestinal disorder. When you talk about gastrointestinal disorder, you talk about all the system within, from the throat to the to the intestine. I mean, you talk about the ileum, you talk about the duodenum, you talk about a lot of them, you talk about the nephrons and all the rest of them. So patients going through with gastrointestinal disorders, you be able to know the kind of um uh, 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 care you have to give. I mean, from the nose, cyanosis and all the rest of it, down to the stomach. That is all about gastrointestinal disorder. Then the next one, guys, is nursing care over a patient with urinary system disorder, a patient who is unable to urinate, he's having difficulties, is a disorder and is an infection. It could be as a result of one infection, or maybe lack some liquid in the body and all the rest of them. So this kind of patient, this this particular topic will go a long way to help you know how you'll be able to care for this particular patient. Remember, when you understand your catheterization properly, this will enable you to give you an idea on how to administer care to this particular patient. Then another one is a patient with endocrine disorder. That is when you talk about the body hormones. I mean, how do you administer care to patient going with hormones disorder? I think this topic will really help a lot. Then the next one is care for patient with muscle or yes, with muscles and connective tissues disorders. So these are all disorders when patients are going through these connective patients with sclerosis and all the rest of it. So you'll be able to know the kind of pain they are going through. Patients with all these muscles and connective tissue, just like these sickness was these for example arthritis and all the rest of them, you'll be able to know what kind of care you can administer to such patient. Then the next topic is patient going to a care you can render to a patient going through central nervous system. That is when a patient is going through stress and going through neurological disorder. You as a nurse, you will be able to know what kind of role is expected of you to play, or care that you really need to administer to such patient. So guys, if you really like this video, please don't fail to give me comment on my comment section. Bye bye.